Good morning. Thanks for coming in on a beautiful day. So I just wanted to speak a little bit on vitamins. And if you're like me and you go to the store, Costco or grocery store, you go into a Giant and you go to find some vitamins. In my case, I'm often finding it for my kids. But you see all these bottles and you just don't know what to get. Especially for a loved one or for yourself with macular degeneration, it's one of the common questions we get in the office. What should I be taking? What should I be doing? This slide is not to represent, what you should be doing, but just a variety of options that you often run into. There's these eye caps, and there's all these different formulations of eye caps, or you see PreserVision, or you see, PR, and you see all these different names, and it's really hard to figure out what's going on and what you should take. And I'd like to just boil it down today, this morning, for you, into what we know from the science so far. And as what my colleagues have alluded to earlier, that science continues to evolve, and especially in the vitamins and nutritional supplement market, if you will, there's a lot of science, there's a lot of ever-changing market research, and so this is something that will probably change as time goes on. But let me just give you what we know now, as of today. So we base a lot of our recommendations on a study that occurred within the past decade or so, and it's called the Age-Related Eye Disease Study, or AREDS. And this came up with a formulation of vitamin C, E, beta-carotene, which is essentially, you can think of it as vitamin A, and zinc and copper. And those are the amounts there. And this is what we call to or refer the Eretz Formula. So these top three are antioxidants, and then the bottom two, zinc and copper. Eretz, in this study, they randomized patients to 4 groups. Patients took either a placebo, which is basically nothing, antioxidant and only, or just these vitamins A, C, and E, or zinc, or both. And so what they did was they followed these patients over time to see how they evolved and how, in terms of their macular degeneration, how it progressed. And so from the Eretz study, we could see here from this chart, the patients who just were on placebo or nothing is the green, and their rate of developing advanced macular degeneration over this course of 7 years is much higher than the other groups. The lowest group was the group taking both the antioxidants and the zinc. And so we see here actually the numbers is actually a 25% reduction in the progression over this course of time. So it's not a cure. It's definitely not something that will make the risk zero, but it is something that we have found time and again that this is the recommendation from the study, that patients above age 55, especially with categories 3 and 4, meaning intermediate stage macular degeneration or worse, they should consider taking the Eretz Formula based on this data. There was some data that also suggested, though, that beta-carotene, which was one of the ingredients on there, in patients who are smokers, or have a very lengthy smoking history, there was some slight increase in lung cancer rate. And so for that reason, smokers should avoid the beta-carotene in that formula, their smokers-free formula. So a common question you get in the office is, if I just have a little bit of macular degeneration, should I be taking it? And so based on the ARED study, though, the information is that the best benefit came for patients with intermediate or higher levels. And so your doctor can give you that risk stratification, tell you or your loved one where they are on the scale. But the best benefit was for patients with intermediate or higher levels of macular degeneration, the dry macular degeneration. So over the past several years, in general in medicine, there's been a lot of talk about eating more fish, omega-3s, basically on Dr. Oz to whatever you want to call it. There's so much out there on this. And fish consumption is a hot topic because we know from medicine that, for instance, American Heart Association recommends eating fish twice a week because fish or marine animals have omega-3 in high quantities. And omega-3 and omega-6 are essential fatty acids. We can't get that just from our bodies. We have to eat it. And those are very important. Essential fatty acids are important to maintenance of our cells, and in particular our inflammatory and immune systems. So we know that heart disease, for example, is related to inflammatory disease and our immune systems now. And we know that if you have taken regular fish or omega-3s in your diet and higher levels, you'll have lower triglycerides, and it's beneficial for heart health. That's been shown. So some of the questions are, how does this relate to eye disease? Lutein and zeaxanthin are two other things that are often talked about in the past several years, and we know that fruits and vegetables, such as in this picture, colored fruits and vegetables, dark colored fruits and vegetables, have a lot of lutein and zeaxanthin. And lutein is one of those, these are carotenoids, these are pigments that are found in these foods, and they're also important pigments that are involved with the back of the eye in the retina. So the Eretz study is part 2 of this Eretz study, and it was a 5-year study that looked and sought to look at some of these questions of whether or not these additional nutritional supplements or nutritional components can be of benefit to patients with AMD. So they looked at, in addition to the regular formula that we just talked about, lutein, zeaxanthin, and also omega-3, and also looked at whether or not lowering some of the doses originally in that formula of zinc and getting rid of beta-carotene, for example, would affect the results. So this study, part 2, they've randomized patients to receive either none of these newer dietary supplements, or the lutein, zeaxanthin only, or omega-3s only, or lutein and zeaxanthin and omega-3s. In addition to this, randomized patients to also continue taking the Eretz Formula, the original Eretz Formula, on top of those categories. They basically split up those patients into 4 groups. So either you take the regular Eretz Formula, or you take some of the other variations of that formula. And those variations here, just to break down the slide, is basically either no beta-carotene, lower dose of zinc, or both of those things. The conclusions, just to tie it up, showed that that replacing beta-carotene with lutein and zeaxanthin was quite appropriate and actually a very helpful way to deal with the whole smoker's history issue. Zinc at a lower dose was just as effective at the 80 milligram dose. And then omega-3s at the dose in this study of 1,000 milligrams a day was not effective in preventing AMD progression. Now that doesn't really answer the question of whether or not higher doses necessarily would be beneficial, but at least at these doses, this did not reduce or prevent AMD progression over a 5-year period. So based on those studies, at this point in time, your doctor may ask you to continue with your Eretz Formula vitamins, but if you particularly are a smoker, taking Eretz 2 is a nice way to get rid of that beta-carotene and to supplement in lutein and zeaxanthin. I personally just tell my patients to make it easy and go with the Eretz 2 formula at this time. Some of these other things we've already talked about, though, are very important and with regard to managing the dry AMD and shouldn't be ignored. Just if you're taking the vitamins, shouldn't ignore the other things as well. So definitely avoiding smoking, taking a good approach to your overall health, exercise, cardiovascular maintenance, and then screening your vision at home. If you have dry AMD, particularly if you're taking these vitamins, chances are you have intermediate or higher levels. You need to be aware of progression to wet macular degeneration. And I want to emphasize the last point, introducing my partner, Dr. Ho, is that stay up with, we'll keep you updated, but stay up with your doctors as well with your clinical trials and emerging data, especially as it relates to vitamins in this talk. There's a lot of things that may be changing, as Dr. McGuire alluded to, with being able to know your genetic profile, being able to adjust your vitamin therapy. So a lot is changing, but this is some of the data from what we have today.